And just to give you a little bit of an overview, I'm going to try and touch on digital therapeutics and supportive care, looking at the evidence of benefit of these particular digital approaches, and thinking about how do we really take some considerations around designing and delivering as well. Like Ethan, I want to start with the patients and get us grounded in the fact that we know that patients who are diagnosed with cancer, it's a devastating diagnosis, and they continuously tell us that cancer changes everything. And so we need to think about, in terms of supportive care, and how do we help people to pick up the pieces of their experience in going through a cancer diagnosis, that it is devastating, and we need to think about, when we're thinking about digital health, that when we're adding those to their armamentarium of things that they're doing in a day, we do need to consider that as well. So supportive care in cancer, of course, has been looking to penetrate across cancer centers around the world. And surprisingly, we still have a long way to go to ensure that supportive care is something that happens proactively to patients at the time of diagnosis and across the whole continuum of cancer. MASC has certainly taken this up as a challenge and has defined supportive care and looking at it as how do we actually integrate it and embed it as part of standard of care. And so their definition is on the webpage and certainly included here, and just reminds us that it really does include some of the symptoms that have been talked about so far in the talk, the psychological symptoms, the side effects across the whole of the experience, and of course it also focuses on those salient issues within survivorship around enhancing rehabilitation, dealing with late effects and long-term effects of cancer as well. So when we think about supportive care, we need to understand it's not reaching everybody. So can digital health and digital solutions really help us to reach people where they live in their home, as Monica was talking about, for other types of therapies. So COVID has had all of its challenges in terms of what it's challenged us and how it's really sort of influenced our lives over the last 2 years. But one thing that has happened with, of course, COVID, it has truly shifted the digital environment. That was already happening. We were already living in the digital space, in a digital world. But the pandemic itself has really shifted to thinking about how do we do this better, what does it need to look like, and so you can see these are some of the common newspaper advertisements that came out, and even Paris Hilton wants to be the queen of the metaverse as we move into the next era. So Tim Shaw, who's probably here, I know he gave a talk, has sort of tried to make sense of this lost in translation, because we talk about mobile health, we talk about web-based health, we talk about the Internet of Things, we talk about e-health. So what are we talking about when we're talking about digital supportive care, and what does that mean? And so in his definitions, in his article that I've referenced here, he talks about health in our hands, which you've heard about both Ethan particularly talk about, digital technology to monitor and inform health, not just healthcare, but also social media and internet, interacting for health, that it's connecting for real-time health, all the storytelling, social discourse, and then, of course, data enabling health. So as Ethan talked about, those large population health database, big data, how can we use all of this data to actually improve care and to actually understand what is the experience of cancer patients as they're going through a diagnosis and trying to come to terms with what has happened in their lives as a result of a cancer diagnosis. I'm particularly going to be talking about what I call digital therapeutics. And the reason I made this shift is, as you well know, there are so many apps out there that focus on health, but I really want us to start to think about apps and mobile health and e-health, and thinking about this from a digital therapeutics perspective that makes a difference in patients' lives, that really has a health outcome for patients, and that, yes, many of those apps are being used by patient populations, but they may not be the best in terms of what they offer and advice. So digital therapeutics was a new definition put forth by Dang in 2020. And he really talks about that what we need to think about is that these are evidence-based, clinically validated, and regulatory adherent digital health interventions. And they really should focus on prevention, monitoring, management, and treatment of symptoms and diseases, or for treatment optimization. So we know part of the digital therapeutics has certainly involved swallowing, radiotherapy devices or whatever it might be to sort of deal with a whole sort of broader aspect of health. I'll be particularly focusing on supportive care. And what we know that digital technology in supportive care has many, many applications, certainly in terms of psychological support, and that could be delivered, of course, through telehealth, through home visits, through some of the things that Monica talked about, and of course, as you saw from Ethan's work, could also be delivered through remote monitoring as well. But we need to think about, so how do we deliver psychological support? We think about the realm of supportive care and all the dimensions of supportive care. It could include psychological support, psychotherapy. How do we start to think about psychotherapy delivery in a digital therapeutic way? And the opportunities for actually reaching patient populations where they live on a wider scale. And then, of course, remote monitoring and support intensification. That support intensification can include things like really smart designs where you're actually increasing the amount of support to a patient who's trying to manage weight loss as one of the toxic effects of breast cancer treatment or whatever it might be. So we need to start creatively about those areas. Of course, for education, information, and access, especially now, as Monica has suggested, that we're now offering so much virtually. We used to bring patients in and spend an hour or less or more teaching them about their chemotherapy and preparing them. How do we now deliver that? And how do we start to think about doing that differently, and how does it need to look? We can't just take what we normally do as a patient education program and put it on an app or put it on a digital device and assume that it will have the same impact. Research is even being done that, in fact, the way you color things, the way a particular color appears on an app actually will result in a different level of engagement of patients. So we need to start to think differently around all of these areas of digital health and supportive care. And of course, rehabilitation at home is becoming quite common, lifestyle behavior change, and of course, disease self-management. So we know that there's lots of health apps out there, and they actually are doing a lot of work around diagnosis disease. This particularly came from an arthritis study where the app was recommending the particular movement that the patient should make in relation to reducing pain from his osteoarthritis. And the author had suggested that, in fact, some of those advices may actually be more accurate than what we actually sometimes receive from our healthcare professionals. But we also know there's lots of apps out there that may not necessarily be offering good advice. But we do know that mobile health is important. I'm going to not speak about sort of the general universe of mobile health, but I just wanted to make sure it is on the table because we do know that patients and families are using mobile health increasingly worldwide. And, you know, here's the numbers. 85% of Americans have a smartphone. 350,000 mHealth apps are available in major app stores. 87 million people in the United States use a health or fitness app in 2020, and you can kind of see that there's all kinds of different devices for apps. That reminds me, my watch has just told me I didn't get out for my walk this morning. So when we think about mobile applications, this was the Commonwealth study that actually showed that, again, of the ones that actually got into the systematic review or the scoping review, then when they looked at mobile apps, you can see that it's on my left side, of the 376 that got into this idea of a digital therapeutic approach to mobile apps, that 24% really had limited engagement beyond traditional media. 66 or 18% were not relevant to the search condition. So in fact, they talked about that they were for managing cancer or health or some aspect, but in fact were not directed in that area. Others had poor ratings or reviews. Others were assessed as not helpful. And certainly from an Android perspective, the same issue occurs, that there's limited engagement with some of the mobile apps out there. At the same time, we're seeing widespread use in the previous slide that I talked about. But bottom line is, of the 161 iOS apps and the 152 Android apps that were assessed as possibly useful, most of them really had a lot to be desired in terms of how they were actually monitoring and supporting patients' health acquisition. So that means that what's happening in the world right now is that lots of organizations are starting to say, you know, we know that digital health is important. We know that people are using digital health to manage their health and their diseases. What do we need to do to start to think about making sure that we get the right things in their hands, so that mobile health apps and devices are now being reviewed. So this is a group, the One Mind Cyber Guide group is a group of psychologists. They've set up a whole shop to actually review apps and determine whether some of these chatbots, some of these PTSD apps, CBT apps, for depression, meditation apps, and what they're doing is they've set a framework for reviewing the apps in terms of not only their utility and usefulness, but also really understanding, are they really what we would approve of for what we would want our patients to access in mobile health. And so they've got a whole website that you can actually look up some of the common apps and potentially find them. Additionally to that, the regulatory environment is stepping into this field, and the FDA has set up a Center of Excellence in Digital Oncology, and this is just their sort of acronym on the side. I won't get into that in any length, but there is a new APA partnership. The American Psychiatric Association is partnering now with the FDA to look at regulatory oversight for some of the medical and mobile apps that are out there, and starting to think about which ones do we actually think could be actually integrated within clinical care. Just to give you an example, Kaiser Permanente, as an example, uses 6 well-vetted cognitive behavioral apps in their psychosocial and supportive care program. So it's coming, but we need to think about, are they the right ones and are they helpful for patients? So when we think about, the hard work of patients, and we think about digital health, we also need to think about that what patients are looking for is they want a one-stop shop for information to understand that's tailored to them, to understand what's happened to them, their cancer experience, but also how to have that tailoring and directed information and advice around how to manage the psychosocial effects of cancer. What we found in this particular study is patients still talked about that they weren't getting the psychosocial and supportive care that was desired, and they were really finding that cancer was really hard work when they were trying to manage all their treatment toxicities as well as the toxicities related to the psychosocial aspects. They wanted support to manage. They wanted the unacknowledged impact of cancer. So when we start to think about digital supportive care, we really need to think about the patient's experience, both from the work they're doing already and the complexity of that work in managing their cancer, but also the complexity that needs to be placed in apps or minimized and reduced in apps because they need to use these to manage these effects that they're talking about in clinical care. This is just an example, and I think Samantha's in the audience if anybody has questions for her, but this is just a recent qualitative discovery work we did in blood cancers just to determine, so what do blood cancer patients want in an information and supportive care app? And they talked about accessibility, one place that they can get all the information that they need to access. They want all the variety of push notifications and email, remote monitoring and reminders and all of those key things. They really want tailoring. They don't want to have any kind of supportive care program that's digitally delivered that is generic, that could apply to everyone. They really know there are some core issues, but really want to have some tailoring related to their particular disease and their particular profile. They want to be able to enter data in the profile related to where are they at in terms of age and lifestyle, and be able to have information that's tailored around supportive care and psychosocial management that says, yeah, fertility is a concern for you, you're young. Let's talk about that in this digital supportive aspect of the care that we're providing you. And additionally, the content is probably nothing that would surprise you around the whole area of everything related to how to manage all the effects of cancer, including the psychosocial effects. But what we heard very loud and clear in this particular study is they didn't want your typical medical supportive care digital solution. They really wanted something that would actually attend to their whole person health, both the integrative and complementary understanding from a supportive care perspective, but also that the whole aspect of life and how they were actually going to reach a level of whole person health became incredibly important, that they talked very clearly and loudly about in the solution for the application that would be created for blood cancers. So in many ways, this is a bit of an example, the iManage Cancer that's been out there for a while, and they've been testing that in the UK, sort of a one-stop place where there's all kinds of digital supportive care aspects within this particular solution, but you can kind of see they've also used gamification, and especially younger populations. We know they do very well with supportive care, digital support that actually uses games, and there's so much work being done around games and virtual reality in psychiatric care right now that we're actually starting to move into this era in this particular different space. But this is a really good example of that one-stop place that we heard our patient populations talk about. So are digital interventions effective in supportive care? So I sort of summarized looked at a lot of the systematic reviews, and no surprise to all of you, in terms of symptom distress and management, supportive care digital solutions show good effect on reducing some of our common, most problematic symptoms for cancer patients, such as pain, fatigue. Changes, of course, the self-management capability and capacity of patient populations. It certainly has an effect on that. But there is inconsistency for reducing psychological distress. I suspect some of that is because of the measurement of psychological distress and whether they're measuring depression or they're actually measuring sadness or emotional distress. But the other aspect of that is many of these supportive care digital technologies do not particularly target the salient aspects of emotional distress and what actions the patient can take to manage those, and do they actually deliver a level of psychosocial support that is part of that particular approach. And then, of course, physical activity and lifestyle. So we know digital technology works, and we know it works for these situations, but what we do see is significant heterogeneity in studies and designs and solutions for digital technologies for supportive care. And we really need to come together to actually look at what really is the things that work, what really is that sort of link to outcomes within those digital apps, and really have a good understanding of these complex interventions as to how they make the difference in health outcomes for patient populations. And there's lots of studies out there that show mixed effects across all these domains as well. So just to give you an example of using a mobile app, for instance, in terms of a psychological, this group, the IntelliCare group, has done 3 clinical trials. And what they showed, and I really want to just draw your attention to that, when they actually measured depression using the PHQ-9 and anxiety. And what they found was that the reduction in the intervention group was equivalent to psychotherapy and antidepressants delivered in an in-person care model. So we know that there is a real potential for digital outcomes in this area. Additionally, in the effects on mental health, you can see that there is definitely in the review that I did and summarized that the effects on mental health, that there's definitely improvement when you look at meta-analyses across a number of studies. And again, mental health from the broadest perspective, cancer populations included in that, but real sort of depression outcomes are improved as well. So we've started to shift to think, how do we get from where we were and to start to shift from move fast and break things, which was, I was featured on the cover of one of our magazines called Disruptive Medicine, Disruptive Care, and Disrupting Care. But we now are starting to think that was kind of a little bit of an era of let's, move fast, break things, not working what's happening now, and let's now move fast with intention. How do we get really strategic about this? How do we think about working all of these digital technology solutions for supportive care in co-design with patients? I'll just briefly tell you a little bit about this study because I know Monica's there. I just want to share with you. So when you think about supportive care, a lot of supportive care digital technologies have been created across the continuum of care, absolutely, but there's been very little work around proactive work related to acute treatment toxicity. So this was just our first attempt at and we've tested this in a trial, and you can look at Monica's presentation if you get a chance, to look at proactive self-management support that also included coping with cancer as one of the particular chapters or areas of focus within this. And again, we embedded all of the things that we know about from the literature are important from a behavioral perspective that have to be built into our digital technology apps to make that difference for patient populations. And I'm not sure you can see that as well as I'd like you to, but definitely we saw a signal. This is a really tiny study that married both the self-management education that was focused on the whole person aspect of going through toxicities of cancer treatment, and married with cancer coaching by nurses. And we did see a shift in patient activation. You probably can't see it here clearly, but those in the intervention group moved up to what we call the level 3 or level 4 of patient activation, where they're actually taking action on their health and taking on the tasks required to manage their health. And what we saw in the control group is they stayed in the lower levels, which is I really count on my healthcare provider to tell me what to do to manage my health, versus those high levels of confidence that we started to see were shifted in this very, very small piece of work. So what we're also seeing, as I start to wrap up, is this whole idea that the other thing that COVID has really shifted is this whole idea of thinking about wellness and shifting from a more medical paradigm of digital technology to more of a wellness paradigm of technology. And really that sort of proactive approach to health. You know, in our work with patients using digital technology, we often hear, wow, you know what was really helpful about that particular, the SmartCare digital technology I just showed you? What was really helpful about that is you told me what I could do to manage quality of life, you told me what I could do to manage my nutrition, and all of the things that were happening in my life, not just the treatment toxicities as part of going through the cancer experience. So we're seeing that shift from the medical paradigm that's about reactive care, and as you heard the patients in the blood cancer study, they want attention to wellness, they want attention to health, they want to regain that back. If you think about that early, slide with diagnosis, everything changes. How can I get back to a life that I had before, and how can I actually thrive with this cancer diagnosis? So we're moving into that era. Thankfully for COVID, it's already been there before that, but it's even shifting us further to think about how do we keep well, and part of that is because we're hoping we won't get a disease like COVID or some of the other things that are coming down, but also thinking about that individual responsibility, preventative and holistic. So this is the new definition of whole person health that I thought you'd appreciate. When we start to think about supportive care digital technology solutions, we need to think about these from a whole person perspective. Are they just to deliver medical care? Are they delivering psychological care, or are they delivering a broader aspect of being able to thrive and wellness and all of that entails? And this is the definition that came from the National Center, and of course it was focused on integrative health, but I think this is much broader than just integrative health. It's all about that wellness aspect. So it involves looking at the whole person, means helping and empowering individuals, communities and populations to improve their health. It's multiple interconnections between the biology, the behavioral, the social, and environment. So when we start to think even about remote monitoring, how much have we built into remote monitoring management of the psychological aspects of cancer? And as you heard the patients in our study, it's fragmented. They really want that attended to. And then again, instead of treating specific disease, whole person health would really look across the lifespan of wellness. There is a group that I was really quite fascinated with, the Transforming the Veterans Healthcare System, the new VA, where they are really focused on, and there was an article in one of the journals that says, the VA system has moved from what was considered a very dirty, very, poor sort of delivery of healthcare to the veterans that have served the U.S. In the Army and otherwise. And what they've done is they've totally transformed their care system to actually have these approach that the pathway is about actually what matters to the person. When we think about remote monitoring, we always talk about what matters and understanding the remote symptoms that we're reading in alerts and saying what matters to this person and how to manage those data that's coming in. And what they've done is they've created well-being programs, they've integrated whole person care, and there's multiple studies coming out that it shows a difference. Just think about digital technology in the future. And right now, this is not digitally delivered. Where could we go with thinking about transforming healthcare in digital technology for supportive care? So where to from here? We need to think about many of the things that you've already heard about, embedding into care, digital infrastructure, reimbursement for scale-up that Ethan talked about, upskilling of clinicians. We need to bring in that equity lens when we're developing supportive care, and we really need to think outside the box to whole person health and what that might look like. And just to wrap up, so people must be at the center of connected health for cancer. We can improve patient engagement through technology, but with IT and advancements, we cannot think about the patient experience, the human experience of going through a cancer diagnosis and going through life and everything that entails from being able to think about our wellness and health as we experience. And they desire a whole health experience, not just a medical care experience. It's important for us to think about that as we move into the future. Thank you.